Good afternoon, everyone, and welcome. My name is Matthew Fagan, and I have the great privilege of chairing the National Mental Health Consumer Alliance, and I have the job today of hosting the. I begin by acknowledging the traditional owners of the many lands we are connecting from today. I pay my deepest respects to elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples with us today on this webinar. I'm coming to you today from the lands of the Nuanoni people, which is the beautiful island of Lunawanna, otherwise known as Bruny Island, which sits just off the coast of Lutruwita, which is also known as Tasmania. Importantly, this acknowledgement is not just a formality, it's a recognition that sovereignty was never ceded, that these always were and always will be Aboriginal and Torres Strait Islander lands. And to help acknowledge this, I understand that people with greater technical expertise than myself might be putting up a widget in the webinar that enables you to record the Aboriginal or Torres Strait Islander country that you are working from today. And I'd encourage you to share this with others on the webinar. I'd also like to recognise the very importantly that First Nations people had the world's oldest systems of care, healing and collective well-being. And these are systems grounded in kinship, in culture, in land, and in spirit, and inform and should inform all the work that we do. I'd also like to celebrate the allyship that the Alliance has with the Indigenous Australians Lived Experience Centre and the leadership of our two First Nation board members, Leilani Darwin and Louisa Sally. Their guidance ensures our work is not only informed by First Nations lived experience, but also by cultural knowledge, and ensures that we're grounded in principles of self-determination. And as we begin today's launch, I'd invite everyone here to hold in mind that true healing and justice in mental health must be built on truth-telling, cultural safety, social and emotional well-being, and respect for Indigenous ways of knowing, being, and doing. That's the knowledge that has cared for this land and its people since time immemorial, and has been passed down through the longest living culture in the world to us. I'd also just like to provide some introductory remarks about today's webinar. It's a truly important day for the Alliance and its thousands of diverse members across every state and territory. And we're very grateful to us for you joining us today. We're here to launch the new 3-year strategic plan of the National Mental Health Consumer Alliance. And like all strategic plans, this document looks to the future. And in particular, the window of opportunity that we have in the next 12 to 24 months to positively change mental health systems for hundreds of thousands of people. But very importantly, this plan also acknowledges the past, the fact that it's a plan built on decades of struggle, advocacy, and persistence by people with lived experience of mental health challenges. The plan represents the courage of those who came before us, those who have fought against coercion, against discrimination, against abuse, against stigma, and against exclusion. And it represents the collective work that thousands of mental health consumers are doing right now to protect human rights and create the space for people to live their best life. And hopefully, and this is our aim, the plan supports the work that is yet to come by those who stand together in solidarity and those who are determined to build a better future. We stand on the shoulders of people who have long insisted that consumers are not passive patients, but are experts by experience. People whose wisdom is essential to systems that will truly and actually work. Quite simply, the plan calls for mental consumers to design, to commission, to staff, to manage, and to govern the systems that impact our lives. And you know what? That shouldn't be considered such a radical ask. It just makes sense. It will work. So the strategic plan sets a bold agenda for the years ahead. It calls for rights and protections for consumers, including those rights and protections being enshrined in a Commonwealth Human Rights Act. It calls for nationally legislated and funded consumer-led services. It seeks innovation and co-design, ensuring new models of care that are created and led by us. And it very much is focused on equity, so that First Nations communities, culturally diverse communities, those in rural and regional areas are never left behind, and in fact are at the centre of what we're doing. And at its heart, this plan is about dignity, it's about choice, and it's about justice, about ensuring that mental health consumers determine our own needs, shape our own solutions, and hold power to account. It's ambitious, it's unapologetic, and we believe the strategies in it are absolutely necessary. Okay, enough from me in the beginning. So before we dive in, a few housekeeping notes. Today's session is being recorded. Please use the Q&A function at the bottom of your screen to submit questions. We may not get to every question live today. We're going to try, but we rest assured we're going to capture them all and share an FAQ summary in a post-event email that will go out to everyone. And if you experience any technical issues, I feel like this advice is turn it off and then turn it on again. Yeah, please refresh your browser or reconnect using the link in your email. That's the extent of my technical advice and expertise. Okay. Now, I was set to introduce you to Alliance board member Tash Smythe, who's a fellow Taswegian, and the CEO of Mental Health Lived Experience Tasmania, and a very proud Alliance board member. I do want to say Tash has, literally at the last moment, been called into a meeting with the Minister's office about a very public crisis in the provision of private mental health care services that's currently playing out in Tasmania. If you're interested, after this webinar, Google it and you'll see that Tash is involved in that right now. And it's testament to the work of Tash and Mental Health Lived Experience Tasmania, and I know this is the case in every state and territory, that when it comes to finding solutions to the thorniest issues, consumers are increasingly recognised as those with the innovative answers. And that's why Tash is being called away today. But to step in for Tash, we have the equally remarkable individual in Priscilla Bryce. Priscilla, for those who don't know them, is a non-binary autistic ADHDer and mental health consumer, and the inaugural CEO of the Alliance. Before this role, Priscilla was CEO of Being, Mental Health Consumers in New South Wales, and Priscilla is the founder of the award-winning anti-racism organisation All Together Now. Priscilla also serves on the board of People with Disability Australia. Please welcome Priscilla.
Thank you so much, and good afternoon, everyone. I also want to acknowledge the traditional custodians of the land we're all meeting on today and pay my respects to elders past and present. I extend that respect to all Aboriginal and Torres Strait Islander peoples with us, and I recognise that sovereignty was never ceded. It's wonderful to be here among so many advocates, allies, and leaders who share our belief that mental health care in Australia can and must be different. Our story begins in the 1970s when those who had experienced the mental health system firsthand began to organise, not as patients, but as advocates. It was a time when large psychiatric institutions still existed. Coercion was common and people were locked away, restrained, and silenced. But small groups began to resist. Across community halls and kitchen tables, survivors formed collectives like the Campaign Against Psychiatric Injustice and Coercion. They were demanding basic rights, accountability, and an end to institutional abuse. Their message was revolutionary. Mental health consumers are not problems to be fixed. We are people with expertise, insight, and the right to determine our own lives. These early advocates laid the foundation for the language we still use today, the language of lived experience, of consumer rights, and of person-led care. They shifted the conversation from pathology to power, from deficit to dignity. By the 1980s and 90s, the movement began to gain formal recognition. The Victorian Mental Illness Awareness Council, now VMIAC, was founded in 1981 and incorporated in 1986, becoming one of the first consumer-led peaks in the world. Other organisations followed, Being in New South Wales, Comwa in Western Australia. This era saw critical moments of accountability. In 1983, the Richmond Hill Report in New South Wales recommended the closure of psychiatric hospitals and a shift to community-based care. In 1991, the United Nations Principles for the Protection of Persons with Mental Illness set a global human rights standard. And in 1993, the Burdekin Report, Australia's landmark inquiry, called the treatment of people with mental health challenges a national disgrace. It exposed systematic neglect, poverty, and abuse, confirming what consumers had been saying for decades, that mental health is a human rights issue, not just a clinical one. It was the first time government recognised that listening to lived experience was not optional, it was essential. Following the Burdekin Report, the 1990s brought new opportunities. The first National Mental Health Strategy mandated consumer participation and established a National Consumer Advisory Group, reporting directly to the Federal Minister. Consumer consultants began to be employed in hospitals and services. Our voices were finally entering the room, but too often the invitation came without power. As governments began to adopt the language of participation, the movement pushed for something deeper: co-design, co-production, and consumer-led governance. We didn't just want to be consulted, we wanted to lead. The shift from tokenism to leadership became our rallying cry. The 2000s and 2010s saw our movement expand its reach, building on decades of activism to demand structural reform. Mental health consumer peaks worked within national inquiries, royal commissions, and government reviews, ensuring lived experience voices were heard in the nation's decision-making. Consumer advocacy helped reframe mental health through a human rights lens, connecting it to the global disability rights movement and the UN Convention on the Rights of Persons with Disabilities. We championed language that was strengths-based, person-centered, and grounded in justice, replacing mental illness with mental health challenges, and replacing stigma with discrimination, because rights violations are not attitudes, they're systemic behaviours. Peer work grew from an idea into a recognised profession. Peer-run services, lived experience workforce strategies, and consumer-led research began to redefine what expertise means in mental health. We also saw the birth of new organisations, Lelin in 2016, Millet in 2018, and Malik in 2021, each carrying forward the torch of lived experience leadership. By 2019, it was time for the movement to unite nationally. That's when the National Mental Health Consumer Alliance was founded as a collective, bringing together every state and territory consumer peak, alongside First Nations lived experience leadership through the Indigenous Australian Lived Experience Centre. After 50 years of struggle, we now have a federated national peak, built from the ground up by and for mental health consumers. And finally, last year in 2024, the Alliance was formally recognised and funded by the Commonwealth, a milestone which is generations in the making. So to summarise, the Alliance is more than an organisation. It's the culmination of 6 decades of activism, of people who spoke truth to power, challenged coercion, and reimagined what care could look like. Thanks, and I'll pass back over to Matt.
Priscilla, very much. I want to, before we move on, I just want to honour also the voices of those who have intersecting experiences of discrimination and coercion and marginalisation, including people from our LGBTQI plus communities, people from culturally and linguistically diverse backgrounds, young people, those in rural and remote areas, and people living with intersecting identities. You are welcome of us, included with us, and at the centre of everything that we do. Our next speaker is Simon Cattell. He's the CEO of Mental Health Lived Experience Peak in Queensland. Simon is a nationally respected advocate and consultant with deep experience in community development, in law reform, and in mental health regulation. He's made significant contributions to the Royal Commission into Victoria's mental health system and advised on human rights compliance within the Victorian Department of Health. Simon's now going to take us through the mental health policy landscape, past, present, and what still needs to change. Welcome, Simon.
Thank you, Matthew, and thank you for the opportunity to speak today. I'm joining you from Sovereign Yagara and Turrbal country, and want to pay my respects to elders past and present as well. So you've heard a bit of history there from Priscilla about, I guess, where we've come from. So as you forecast, Matt, I'm here to talk a little bit about our policy work. So the National Mental Health Consumer Alliance enters the policy conversation at a really important time, an important phase in mental health policy in this country. I guess the question some people who are not familiar with us might ask is, well, why do you need the Alliance to define and drive mental health policy in this country? Isn't lived experience at the heart of everything everyone does? And we often hear that. Well, I guess one of the perennial challenges, and we've heard this a little in the history so far, but one of the perennial challenges we face in mental health policy and the mental health system more broadly is that it's been one not designed and defined by people with lived experience, and it's not been one designed and defined on a human rights framework. Indeed, many of these concepts of lived experience and human rights have come 200 or 300 years after the establishment of modern mental health systems. So we've got a lot of work to do, and partly because we're so late in the piece, we also have a lot of work to undo. The modern mental health system, as Priscilla highlighted, was one built in this country without people with lived experience. It was also one built through a process of colonisation. The early colonies established that mental health system, through a criminal legal system framework, and it later shifted to a civil mental health system framework, but still was custodial in nature. So what is that? You might be wondering, what does that custodial framework mean when we're thinking about mental health policy? At its core, it means that we're fusing care with control. And the early mental health systems function, when you think about care and control, was to monitor people. It eventually developed a focus on treatment, but it still retained that overriding focus on monitoring and control. When consumers define a vision, a policy-based vision of what the system is for, it's not one based on monitoring and control. It's one based on supporting a good life as defined by each of us. So treatment, when we talk about mental health treatment, might be a part of that, but it's not the ultimate point of the system. The point of the system is to support a good life as defined by each individual who is accessing that system. And so we've got work to do. Now, as Priscilla indicated, the Burdekin report came out in 1993, and it found that there were mass human rights breaches across the system. It found that people with lived experience suffered widespread, systemic human rights breaches and discrimination. It found that that movement towards deinstitutionalization was incomplete, fatally flawed, and the promises were not delivered on. It also found that the absence of appropriate housing and accommodation were among the major factors impacting people's mental health. These are human rights abuses, and they're the product of political and community choices. And it's mental health policy that continues to make these circumstances possible. Today, Australia continues to fail to live up to its promises. It fails to live up to the Convention on the Rights of Persons with Disabilities. We've made an interpretative, it's a long word, it's a very technical lawyer term, declaration that exempts us from a full shift towards a supported decision-making system based on free and informed consent. So what does that mean? It means we signed up to an international human rights law, but we made a declaration ourselves that key parts of it don't apply to us. So as a consequence of that, coercion, seclusion, and restraint remain an organising feature that holds our mental health system together. So our system is only held together by force, not by the fact that people want to use it. We haven't adequately implemented the UN Declaration on the Rights of Indigenous Peoples. Cultural healing, adequate community-controlled funding, safe and culturally safe mainstream services are still not a feature of our mental health system. So at its core, our system and our policies still fail to live up to the promises that we've already made. So there's obviously work to do, but it's important to acknowledge that work has been done. We have developed disability discrimination laws. We have developed national policies on the lived experience workforce. We have developed state consumer peaks, and as we see here today, a national consumer peak. And much of the work is a consequence of the people here on the webinar today, not just speaking, but rather the people in the audience. So the question, we're now at this critical juncture where the National Mental Health Consumer Alliance, which is not the people on the webinar here, it's everyone in the room with lived experience, we're at this critical juncture where we will play a leading role in mental health policy going forward. But what would that look like, and how would that be different? Well, it would look like different understandings of what the system is for and what it should be trying to do. Is the goal of the system to merely provide mental health treatment, or is the goal of the system to respond to each person's individual needs to support a good life as they define it? It will look like different ways of understanding and defining the policy problems we face, and what and who keeps those problems in place. It will look like different solutions to these problems, grounded in our different ways of knowing and being, and in the collectively and evolving knowledge that we've developed, knowledge that's developed in a process of justice making. It will look like the removal, creation, and realignment of different institutions to realise these visions, to solve these problems, and to implement these solutions. This is something that I'm really proud of, and I know we're really proud of being able to co-develop with everyone here together. I'm now going to pass back to our chair, Matt, who will outline how we're going to do this work.
Thank you, Simon. Can you all hear me? Thank you. I didn't stuff that part up. So um, I'd now like to share how the Alliance's strategic plan has built on the legacy of consumer leadership and how we're positioned to work with all of you on a new era of lived experience-led reform. I should mention too, thank you for all the questions that are appearing in the Q&A. And I do just want to address, we will get to the questions later, but I just do want to address one that's at the top of the list about might future documents be in plain language, as posted by Brian. And I think that that's an excellent piece of feedback. And I'd like to commit, I might be getting in trouble for this, but what the hell? I'd like to commit that not only will future documents be in plain language, but we'll make an effort to ensure that this current strategic plan, a plain language version of that is produced as soon as we possibly can. So Brian, thanks for the feedback, and that's something that we should definitely do. So Rachel, Priscilla, sorry for committing to us that to you without consultation, but I think it's a critical measure. So at the heart of this strategic plan and of the Alliance overall is that powerful idea that's common to many people who've experienced intersexual discrimination, abuse, and human rights violations, which is, nothing about us without us. And there is a danger of that just becoming a slogan, but for us, I think we're very mindful that it drives every part of our work, from grassroots advocacy right through to national influence. And it's reflected in the vision set out in the strategic plan, which is simple and yet also, I think, all-encompassing, which is mental health consumers determining our needs and wants. And this vision deliberately has a special double meaning. It is, of course, about mental health consumers shaping and governing mental health systems and cultures in order for us to be able to exercise choice and control. But it's also a constant reminder to those of us who are in positions of leadership within the Alliance that we are subject to direction from consumers at all times, and that our organisations only exist to give voice to consumers. So that double meaning in our vision is incredibly important to us. Our purpose, which is set out in the plan, is our true north, providing our focus and direction, which is to design, deliver, and lead mental health services and systems, keep those who hold power to account, have our human rights upheld, and to embrace and elevate difference. And our values, which are also set out in the plan, reflect how we show up, how we work together, and how we lead change. The first one is really important to us, that we can have frank and robust collaboration, because if we're going to make progress, we've got to be honest with one another. We have to have courage, and obviously we also have to have compassion at the same time. That in true radical activist, reflecting the true radical advocacy history of the organisation, we want to be always challenging the status quo. We want to be shifting power. We don't want to be maintaining power. We also want to respect the diversity of experience and expertise in the movement, is that people, the various stories that people carry and bring to us. And very importantly, at all times, we want to be open and equitable. that first and foremost, this work is reflected in the work of our state and territory peaks, which is really quite extraordinary. The challenge in communicating to all of you that work, which often happens on a shoestring budget, operating out of shared spaces, scrapping for resources from wherever they can find them. The challenge with communicating that is it would take us all day and then some to go through the achievements and the work that's currently taking place. You know, I spoke earlier about Tash Smythe, the CEO of Millet in Tasmania, not being available today because Tash has been called into a crisis meeting with government. But at the same time, Millet is providing consumers in Tasmania with thousands of hours of remunerated consumer representative work. It is running a program called Self Empower Now, which is engaging hundreds of people with psychosocial disability into the consumer movement, providing remunerated work, helping those people exercise their rights, and helping engender peer support. Millet has shaped the reforms to the mental health system in Tasmania, an incredible amount of work on a tiny budget. The same it could be said of the work of Leland in South Australia. Has to do so much with so little. It's helped co-design a new crisis stabilisation centre in Northern Adelaide. It's brought consumer views into design and new mental health rehabilitation beds in Modbury and the Queen Elizabeth hospitals. It's ensured that people with lived experience contribute to the model of care and co-designed the philosophy of care underpinning the urgent mental health care centre in Adelaide CBD. All this incredible work being done by state and territory peaks. And a shout out to Mental Health Lived Experience Peak Queensland, a relatively new organisation, but being commissioned to respond to recommendations on seclusion, restraint and physical restraint under the Mental Health Act, provides a callback service where people can speak with someone with lived experience for advice and support on navigating systems, etc., etc., etc. Again, all on minimal budgets. And then, on top of all of that work, the state and territory peaks have stepped up to ensure local consumers have a voice directly into national issues as part of the Alliance. Because, as Simon was saying before, the Alliance is not the board or the people who are working so hard in the national office. It's the thousands of people doing work on the ground right now. It's the people who are involved in the consumer advisory groups that are being facilitated by state and territory peaks. It's the people who are involved in the affinity groups that are looking at particular cohorts of people, particular identities, particular sector issues, and really focusing on those issues and bringing them to the national stage. It's a network of national policy experts, all with lived experience, who are working in the state and territory peaks and in the national office and bringing that collective wisdom to our efforts. It is also the board, made up entirely of people with lived experience of mental health challenges, and of course a national office too that, again, I'd like to stress, very few people doing an enormous amount of work, and really having an influence beyond what our resources would normally suggest that we could achieve. But the important thing is that every submission we make, every reform we influence, every campaign we lead is only successful because it carries the weight of those thousands of voices and that those centuries of collective lived experience leadership. That's what makes the Alliance unique. It drives us to not tinker at the edges of a broken system, but rather rebuild it. And at the same time, be accountable to those communities we represent. So I'm deeply honoured to chair this alliance and to walk alongside so many people who are reimagining what's possible. But now I'll hand back over to Priscilla, who's going to take us through some of the specific strategies in the strategic plan. Over to you, Priscilla.
Thanks, Matt. I'm now pleased to present the Alliance's first strategic plan. Our strategic plan is built on 3 national priorities, the pillars of reform that will shape the next decade of mental health in Australia. Each one is about shifting power, resources, and accountability into the hands of the people who know the system best, mental health consumers. We're calling for nationally legislated, funded, and consumer-led services. Services that meet people where they are, not where the system expects them to be. Here's some examples of what that might look like in practice. An NDIS that is co-designed by people who use the NDIS. Psychosocial supports outside the NDIS that are consumer-led, equitable, and uphold dignity and choice. First Nations-led mental health consumer initiatives grounded in social and emotional well-being. Secure funding and national training for the lived experience and peer workforce, ensuring stable, rights-based employment across every state and territory. Medicare reform so that people with mental health challenges can access care without cost barriers or discrimination. And safe, humane inpatient care where sexual safety and human rights are non-negotiable. In our recent correspondence with Minister Mark Butler, we made this very clear. Right now, there are 500,000 Australians missing out on psychosocial support. That's 500,000 of us waiting for systems that truly see us. We have a window of opportunity to build those systems now, and the Alliance is ready to lead that process of co-design. Our second priority is about rights, real enforceable rights that exist in law, not just in principle. Australia is the only liberal democracy in the world that does not have a national act or charter of rights that protects the fundamental rights of its citizens. We are calling for a Commonwealth Human Rights Act with specific protections for mental health consumers, aligned with the United Nations Convention on the Rights of Persons with Disabilities. This must be paired with a national human rights framework that ensures our rights are upheld in every setting, from police powers to emergency departments to mental health wards. We're advocating for a legislative ban on coercion, forced treatment and restraint, replaced by trauma-informed, consent-based care. Protection from discrimination in every environment, from housing and healthcare to workplaces and media. Self-determination for Aboriginal and Torres Strait Islander communities, so First Nations leadership and knowledge guide every reform. Our third priority is about power and leadership. We are creating the structures and opportunities for mental health consumers to lead innovation nationally. This means delivering and extending Commonwealth-funded, consumer-led innovation projects which are already underway. Building and sustaining the peer workforce with fair pay, professional pathways, and proper recognition. Establishing a national register of consumer experts through our state and territory peak body members, ensuring our knowledge shapes reform at every table where decisions are made. And partnering across sectors with national commissions, regulators, ministers, media, and community peaks to embed mental health lived experience leadership everywhere. We're not here to tinker around the edges of a broken system, as Matt said. We're here to reimagine mental health and transform systems from the ground up. So where to next? The year ahead is an unprecedented opportunity for structural change. As you know, the Productivity Commission is delivering its final report on the National Mental Health and Suicide Prevention Agreement to Parliament next week. This agreement sets the tone for the entire mental health system. It determines what services get funded, where that funding goes, and who receives it. For too long, those decisions have been made about us, not with us. This time must be different. We're pushing for new Commonwealth and state funding models that allow peer-led and consumer-run services to thrive, from early intervention to community connection. These supports must uphold dignity, choice, and recovery, not just meet service quotas or tick compliance boxes. And for the first time, there is an unprecedented opportunity for mental health consumers to write ourselves into the next agreement at the highest level, not as advisors on the sidelines, but as equal partners in power sharing and co-design. This is our moment to ensure that lived experience is not only heard, but hardwired into the nation's mental health architecture. So we're also working on maximizing access and outcomes for mental health consumers in the NDIS. Together with disability representative organisations, we're advocating for a co-design model that recognises psychosocial disability as multifaceted and deserving of fair support. Ensuring that psychosocial supports outside the NDIS are equitable and consumer-led, and evidencing and communicating our impact by demonstrating how consumer-led change delivers value for money, better outcomes, and safer care. We'll do this by working with our state and territory peaks and our ally, the Indigenous Australian Lived Experience Centre, to measure what matters: consumer-led impact, not just service inputs. And through it all, we'll continue to do what mental health consumer advocates have always done: tell the truth, build alliances, and hold those in power accountable. Back to you, Matt.
Thank you, Priscilla. And of course, I encourage everyone to read through the year ahead strategic priorities, the medium term, and the ongoing priorities for the Alliance. And your feedback on those is most welcome. I'd now like to introduce a person who I have a great deal of respect for, and who made a very significant contribution to this strategic plan. And that's Leilani Darwin, a proud Aboriginal woman and nationally respected leader in suicide prevention, mental health reform, and culturally informed systems change. Leilani was a founder of the Indigenous Australians Lived Experience Centre and continues to shape national reform through her cultural and lived leadership. It's a great honour to have Leilani here today, and she'll share how First Nations self-determination and lived experience guide our allyship with ILEC, with the Indigenous Australians Lived Experience Centre, and why that partnership is central and critical to reimagining mental health in Australia. Please welcome Leilani.
Thanks, Matt. And thanks so much for having me. I'd like to acknowledge country because I couldn't do it in chat as a panelist. So I'm joining you all from the Jagera, Yagara and Yurrupul People's Country. So I'd like to pay my respects also to all the mob on this webinar and who'll be viewing it once it's posted online, and to really just acknowledge the ongoing support from our ancestors and our elders to do the work that we do every day. For those of you who don't know, myself and Louisa Sully, an incredible Torres Strait Islander woman, joined as two other independent board members to the National Mental Health Consumer Alliance earlier this year. And boy, has it been a fun journey. I tell you what, one thing that I really would like to acknowledge, and I'm going to put out there, is that I consider this strategic plan a landmark piece of work that really, for the first time in everything that I've done across many organisations that I sit on the board with and organisations that I've worked with, has actually genuinely, across all levels of the strategy, really given due consideration and thought to how First Nations people can be self-determined and what that leadership really looks like from a national alliance to not only give us the space to lead this work, but also to elevate and support what we have identified are those needs. And those needs are quite complex and varied. For those of you who don't know, from the 1st of October, the Indigenous Australian Lived Experience Centre is now a fully self-determined independent organisation. And I'd just like to take a quick moment to acknowledge and recognise the support of the Black Dog Institute from the beginning of when I established the centre. Myself and many others had lots of conversations around where was a good place for this to percolate and really kind of get out there. What can we do? What's the support that we needed? And Helen Christensen at the time, and followed by all of the executive team and the board of directors, were incredibly supportive and have been supportive as we've been on this journey to transition into an independent, self-governed organisation. So myself and Tony Lee are co-chairs of the board, and we have had such an incredible journey of how do we actually, first of all, inform First Nations lived and living experience in mental health suicide prevention, but how do we really kind of start to express and explain that it's different? And I know that people can really relate to that in the way that, you know, we talk about it here. Everyone's experiences are unique and they are different. But for First Nations people, we also have multiple layers of issues that we're dealing with on top of that, including systemic racism and issues with not being considered, not being included in the conversation. And so I'd like to applaud my fellow directors and Priscilla and the team and everyone for being so supported to actually really make sure that we've got such a strong voice and are included in the vision and the work of the Alliance more broadly. So thank you for that. I think it's really important for us to remember that, you know, these things are very high level. And I've noticed in the chat, there's a lot of really kind of, you know, detailed questions, and that stuff will come as we do work. The board members have given great consideration to what does this really look like to get the people who aren't sitting around at the tables really involved. How do we get those people who are in rural and remote spaces an opportunity to inform the conversation, to look at setting the agendas and to be included in the reform work that's happening more broadly? And I think for us as First Nations people, it's really important that we actually lead that. And that's where the role of the Indigenous Australian Lived Experience Centre really comes in our national network. We've done a lot of work, including a full rebranding, naming of the centre, which was genuinely co-designed with all of our national network members. And it was really great to be part of that experience where it wasn't about the board members making a decision on something. It was a collective decision, quite a complex one that Eliza led for us, where we really were able to ensure that our vision was heard and at all levels of the organisation. We have a lot of experience, and some which I just wanted to share briefly with you, because I think, you know, we talk about these things in these spaces at such a high level. And a lot of my experiences were as a younger person. And unfortunately, in the last few years, I've had a significant setback in my own mental health challenges. So for those of you who don't know, I've got severe depression, so clinical depression. I've got complex anxiety. I've got complex post-traumatic stress disorder. I've got an eating disorder and a range of other health issues that is not uncommon for First Nations people. What that means for me is that at least once a month, I'm spending probably a couple of days putting all my energy into fighting the illness in my head and staying alive. And yet I'm still afforded the opportunity to sit in spaces like this and to help support and really kind of drive, how do we get this right? What isn't working and how do we do that? And First Nations people aren't often considered, and it's something that I've worked really long and hard to do. I will say sometimes it's a weekly thing, and unless you've experienced it, you don't know how hard it is and how much energy it takes to actually keep yourself alive when your illness is saying that you don't want to be here. But I think For me, it's the collective work of our people. It's all of the people that I've met along the journey. It's my elders, it's my leaders who continue to do that. It's actually organisations like the Alliance committing to 2 First Nations representatives on the board. That is unheard of. And that is where I think we're doing things differently, and we're really acknowledging not only that it's not reasonable to expect a First Nations one person to put perspectives from everyone in the country, because that's not appropriate, but also to acknowledge the 2 distinct cultures. And Louisa Sully brings a lot of incredible expertise as a Torres Strait Islander person to that space. So I, again, would like to thank everyone for that opportunity. Just in finally kind of closing, I think some of the stuff where this strategic plan is really important. There's a lot of things that happen that we don't get an opportunity to talk about. I have personally witnessed and had my own experiences of racist treatment, of being treated like someone who doesn't know what I'm talking about, of not being able to access appropriate supports and help when I needed it in a culturally appropriate way. And there's a lot of things that sit behind, you know, the resourcing issues and all that kind of stuff that we know. But the one thing that I've seen and that has been built through the Indigenous Australian Lived Experience Centre is that we consider ourselves a family. And that gives us great strength in the work that we do, and the beautiful people that we have who are working and living in rural and remote communities, and take those opportunities to really provide them an opportunity to share. And for people to get the experiences and understanding that they would never actually have the opportunity to do. But just in closing, thank you again. I really do applaud this strategic plan. Please make sure you have a look at it. Think about what you can do in your own organisations to really actually support First Nations governance and leadership in this space. We've got a lot of work to do, but we are all working towards the same goal. So thank you very much.
Thank you, Leilani. And again, just to acknowledge the incredible work that you do with the Alliance, with ILEC, and across a range of organisations. It's yeah, it's we're extraordinarily lucky to have you on board. Our final speaker, before we get to some questions today, but definitely not, the last but definitely not least, is Giancarlo De Vera, who's the CEO of Being, Mental Health Consumers New South Wales. Giancarlo is a proud queer, non-binary leader with disability from a culturally and racially diverse background. Giancarlo's got over 2 decades of experience in human rights and law reform, and they've been recognised in Pro Bono Australia's Impact 25 and named among the 40 under 40 most influential Asian Australians. Today, Giancarlo will share practical ways to get involved in the movement through your local peak, through training, through events, through paid consumer representation, etc. And just underlining that the movement belongs to all of us, and it grows stronger every time another voice joins in. So welcome, Giancarlo.
Thank you so much, Matt. Sorry, it took me a while to get myself unmuted. Well, first, I'd like to acknowledge country. I'm calling from the beautiful Yangaba, the country of the beautiful Yangaba people, which ordinarily isn't my country. I normally live on Gadigal land. But I'm incredibly privileged as well to have Indigenous heritage on my mother's side from the Roai people in the Philippines. And one of the things that's really important to that culture is that we like to look back. Even where my family's from, it's in the local language, we had this phrase called lingawen, which means to look back. It's really ingrained in our culture. And I think that's a really good place to start this conversation about where to look for, where to go next. Because we can't look back, we can't go forward without looking back. And obviously, I want to pay, respects to the elders in our movement. But really, the work that the elders in our movement have done over decades, as we heard from Priscilla earlier, is just is just the building foundations of the work that still needs to be done. There is incredible amount of energy, an incredible amount of opportunity that we can harness as consumers that are part of a bigger movement. I think about the fact that this vision of the strategic plan is for mental health consumers to determine our needs and our wants. And like, I want to think about what that actually means for all of us, because when I also think about the values of the strategic plan, and I think about, the lived experiences that define the mental health consumer experience collectively, the diversity of experience and expertise is one we really need to start championing. And we need to be able to be robust and open and equitable in how we can have conversations around all the diverse needs with mental health consumers. And it's from those two values I really want to position this call for you to believe in the vision, understand this vision that consumers have the power, have the rights, have the capacity to determine our needs and our wants. And the issue that has stopped us from determining our needs and our wants has been us not actualizing and realizing our own power. So how do we realize that power? We actually get involved. We have those frank and robust conversations as a strategic value plan's values calls for. We connect with each other. We find community with each other. And the best way to do that is through joining your state and territory peak. There is one in every state and territory, and one coming up through the Northern Territory. And once we have the Northern Territory, there'll be a peak body for mental health consumers across this country. And it's incumbent on us as consumers to make sure that our movement is vibrant and colourful and is inclusive and encourages everyone to be involved. It's how you can be involved. Involved will be different in each peak. In my peak at Being, we have a range of opportunities to be involved. We have a consumer register. We have advisory committees. We obviously support the consumer engagement work of the Alliance. We have spokespeople. There are multiple ways. And if you think that there are the ways that you can't, that you want to be involved in isn't reflective in the way you want to be involved, then speak to the peaks, join the community, get involved and say, hey, this doesn't work for us. Let's actually think about ways in which we can include people in ways that the peaks may not have even thought about. And as we heard from Matthew, where around the feedback around plain English, all of us are committed to growing this movement so it's inclusive for everyone. And so feedback is absolutely crucial in ensuring that we are a movement for all. The other thing I wanted to highlight is the fact that there is so much that we can do together if we are organized. And that is a very important point from my perspective. There's a lot of things we can draw a bucket list of change, of things that need to change that will probably go around the world 20,000 times. But as the strength of the Alliance and the strength of your membership and your active engagement in your state and territory peak is by prioritizing the things that need to change first with the opportunities that are before us. As we heard, this opportunity is now. It's an incredible opportunity. I'm both equally excited and terrified for the opportunity, because if we don't get it right, if we don't seize the opportunity well, the cost is high. But it's because of that we're able to really make the biggest difference quickly if we get involved. So that means if you know people who aren't members of your state and territory peak, encourage them to join. Get them to join. The more people we have, the more we can reflect the voices of our movement. The other thing is that we need people who support and love us to get behind this vision. If mental health consumers are to determine their needs and their wants, then we need our carers, our loved ones, our kin, our providers, our support workers, everybody to believe that. And we have the power to be able to tell them that's what we want to do, but B, tell them that we need to be what I call the first among equals. And so it's a call to allyship as well. So we call for allies to support the consumers to determine what we want and what we need. Thank you, Matt.
Thank you, Giancarlo. Thank you, Giancarlo, for reminding us that participation is power, and that organisation is critical, and that every one of us has a role to play in that as well. Critically important for any movement, including ours. I'd just like to, if I hope you don't mind, just to share some sort of cross-sectoral discussions that I've been having and learnings that I've had from the family and sexual violence movement, and hearing from people in that movement about the similarities with our struggles. And in particular, I want to shout out to a feminist and activist organisation in Victoria called Flat Out, who have shared some of their analysis around the way systems harm and abuse us. It happens for victim survivors of family and sexual violence, but it also happens for people with mental health challenges, mental health consumers. And just wanted to share the commitment of the Alliance to fighting this systems abuse. So when we talk in the strategic plan about one of our purposes being to keep those who hold power to account, and one of our values being to challenge the status quo, they're not just words. That means we fight against three things. We fight against systemic harm, we fight against systemic abuse, and we fight against systemic collusion. And I'd just like to talk about what those three things actually mean. So when we talk about fighting against systemic harm, that's the harm that people with mental health challenges experience because of the rules and the laws and the regulations and the policies and the practices. So we're fighting that systemic harm through our work every day of the week. And it's probably the thing that gets the most attention. But we're also fighting against systemic abuse. And now systemic abuse is when a person, be they a clinician, be they a police officer, be they a public guardian, or an abusive partner or family member, exploit the systemic harm, so exploit the rules, laws, regulations, policies to gain power and control over people with mental health challenges. So we're fighting that as well. We're fighting that systemic abuse that is supported by the systemic harm. And in addition, to sort of round out that fight, we're also fighting against systemic collusion. So that's when we have people or services or organisations that support, enable, or compound the experience of systemic harm that is experienced by people with mental health challenges. And that collusion can happen directly by taking actions that increase the harm and abuse that someone's experiencing, or indirectly by failing to recognise or respond to harm and abuse. And for people with mental health challenges, that includes the services and staff that they get services from failing to recognise and respond to the systemic abuse that people with mental health challenges experience. It can also be the way that governments say one thing to us about commitment to co-design, and then bureaucracies gravitate towards failed clinical models instead. That's systemic collusion. And if we're honest, it can even occur within our own organisations and workplaces. And when we see it, we have to have the courage to call it out. And I'm proud to be part of an organisation that I believe does have that courage to call it out. So I hope that gave further detail about what it means when we say we hold power to account. Before we move on to the Q&A, it is important that I acknowledge the incredible artwork. You'll see it in the background here. That features in the strategic plan. It's an artwork called or titled "Out of the Shadows and Into the Streets," and we commissioned this artwork from mental health consumer and queer advocate Lissy Elliott. Not sure if Lissy is on the here today, but if she is, thank you. An amazing piece of artwork. Lissy's used recycled paint fragments to symbolise how something once cast aside can be transformed into something that's vibrant and vital. And I believe that Lissy's work captures what our movement's all about. Many voices, layered and interwoven, forming something that's larger than any one of us. And the colour and the texture tells a story of lived experience, of grief and growth, of turning pain into purpose. And I think the paint fragments also represent our federated structure, various groups, state and territory peaks coming together as one national voice. And finally, I think the work also, it's a very vibrant work. It's a work that moves. It's not static. And I think hopefully our movement is like that as well. It's alive, it's responsive, and it's always evolving through the wisdom of lived experience. So thank you, Lissy, for capturing all of that so beautifully and adding real value to our strategic plan. Okay. So now just moving to the Q&A. There's quite a few questions in here about the lived experience, so the peer workforce, so the lived experience workers, and the upcoming or the tender that is currently out for the peer association workforce, and the extent to which peer workers are a priority for the Alliance. Priscilla, do you want to respond in the first instance?
Found the unmute button. So as probably everybody knows, there is a grant opportunity out at the moment for a peer association. And Matt might want to talk to this in detail or not. We're still considering whether we would apply for that. My personal view is that I think the peer association is a really good opportunity for peer workers' rights in the workplace to be upheld. So I guess that's my answer, really. I can see this new body coming. It should be launched early in the new year by whoever is lucky enough to get that grant opportunity. And I think that body will be charged with doing a large chunk of that work around upholding the rights of peer support workers and all peer workers. Actually, I see myself as a peer worker. I don't sit with people every day and do peer support work, but I am a consumer, so I'm a peer, and I work with my peers in doing this advocacy work to uphold all of our rights in the system. Don't know if that answers the question, but that's my response.
Yeah, I might add to that a little bit. Thank you, Priscilla. So the supporting the mental health consumer peer workforce to implement trauma-informed, rights-based, peer-led services and receive secure funding and meet the needs of peer communities is a critical strategy in our strategic plan. So it's a significant priority for the Alliance. So just want to confirm that, yes, it's something that we're very much focused on, whether we apply for the Peer Workforce Association tender or not. The second thing I'd like to say is that our board will make a decision shortly about whether we do apply for that grant opportunity, but it will be on the basis that we are there to simply support a peer workforce association that is managed and led by peer workers to be established, for it to be viable, for it to be self-determining. This association needs to be created, led by peer workers. We'd be there to support that outcome, and to help it be a success. It definitely wouldn't be any situation in which we wanted to, be in control or anything of that kind. It is simply to ensure that the Peer Workforce Association is led by peer workers, it's not dominated by providers, that it's able to advocate for workplace safety, that it's able to address psychosocial harm that occurs in workplaces for peer workers, that it's advocating for improved wages and conditions for peer workers, that it's able to collectivise in order to hold providers account for the way that they work with peer workers, to provide greater, to improve status and recognition of peer workers, to be able to advocate for the importance of peer workers, and to have additional research into the benefits of the peer workforce in delivering mental health services. And I also should say too, we spoke previously about the window of opportunity that exists at the moment with the new National Partnership Agreement. From the outset, every communication that we have is about a different way of delivering mental health services that has the peer workforce at the heart of that delivery when it comes to delivery of psychosocial supports. So I hope that that provides some comfort that that's a real priority for us. Anybody else on the panel wish to add? Leilani, you may wish to add something about First Nations peer workers, because I know that that's a very important element of this.
Yeah, and I think actually probably just as an educational piece that we haven't had a lot of opportunities to really be included in that conversation. There have been pockets of that happening. I mean, I contributed to the work of the incredible Dr. Louise Byrne for the National Peer Lived Experience Workforce Guidelines and the First Nations perspective, and also the Queensland one. So I think for me, more as an education thing, is to actually, we need to be included in that. And there is a lot of different things that factor into what that looks like, rural and remote location. I think the other thing, which has been an interesting conversation, I know, and one that we've had at the board level here and across different organisations that I'm included with, is the difference between doing something genuine and doing something to tick a box to say that some inclusion has been given or considered. It's actually a lot of hard work to truly embed that at all levels of an organisation, to make sure that there is clear equity and inclusion around considerations for First Nations people, which often, I will say, intrinsically differentiates from an organisational's goals around hitting KPIs and doing certain things. And us as First Nations people, our obligation is to our community and to our mob. And so there's often a disconnect in what we have to prioritise and how we do that, and an organisation being willing to work within that and knowing that we still bring a lot of value. So I probably
Thank you, Leilani. We've also got a question in relation to the extent to which the strategic plan addresses psychosocial disability in the NDIS and issues with the way that the NDIS isn't working for people with psychosocial disability, and seeking our perspective as panel members on this issue when it comes to the NDIS. Any panel member want to respond?
I can jump in briefly and say that Darren Monday, who unfortunately couldn't be with us today, he's the CEO of Comwa, but also on the board of the Alliance. He attends all the NDIS meetings that he's able to attend. So he is, I guess, our board expert on NDIS matters that are happening at the Commonwealth government level. Yeah, look, we are involved in those activities, but unfortunately, I'm not across the detail as much as Darren is. The other thing I'd say is that we do attend the disability, oh my God, DRO, Disability Representative Organisations. So many acronyms. Meeting every fortnight, and that is basically a group of disability advocacy organisations who do discuss mostly NDIS, but also other disability matters. So we advocate there as well, and discuss as a group what is happening with NDIS policy. Our disappointment that the NDIS is yet to be co-designed, and yeah, other matters around disability. Yeah, I think that's it.
Thanks, Priscilla.
Yeah.
Just to maybe add to Priscilla's point as well, currently there's just over 65,000 people with psychosocial disability in the NDIS. The growth in that has slowed. That's something that we're keeping a close eye on. And the number of participants, the number of people who are applying to join the NDIS and being refused, being unable to join the NDIS has increased. So that's a real concern to us, and it's something that we're also working on as well. So we're very mindful that 65,000 people with psychosocial disability in the NDIS are mental health consumers. That while many are getting great benefit from the NDIS, there are also issues with not being able to get the supports that they need. If any of you on LinkedIn, Giancarlo's posted something today in relation to assessments, and I'll let Giancarlo perhaps add to that.
Thanks, Matt. Look, I just wanted to acknowledge, I guess the changes around NDIS being incredibly fraught for those with psychosocial disability, firstly, and it's not made better by the fact there's so much uncertainty around the NDIS, as we all know, and so I think that's the very first place we need to start. And as we try and unravel with, this question of what does the NDIS mean for those with mental health challenges and those with psychosocial disability, it's because in that context of uncertainty, it's incredibly hard to know the right answer for the problem that hasn't been defined by us. And so that's where I think one of the things that the Alliance is really trying to push for is for us to just collapse a lot of that uncertainty, and say we need to design everything outside of the NDIS. So we know what the systems look like outside of the NDIS, while at the same time protect and defend what we can access through the NDIS, because that's kind of like the strategy in a sentence, really, because in some respects, there's a lot of things happening within the NDIS. As people would know, there was legislative changes around what is defined as an NDIS support through Section 10 of the Act. And then there's obviously related concerns and questions around the evidence that is needed to access those NDIS supports. So that's happening inside the NDIS. Then there's things happening outside the NDIS. Part of the NDIS review work is to embed and bring online psychosocial supports through what will become known as foundational supports, which is, no one knows what that's going to look like. And we're probably at least a year away from even having the conversation, or starting the conversation, I should say. And so when you think about the time lag about what's happening outside the NDIS while all this change is happening inside the NDIS, it's incredibly difficult to be able to, as I said, answer questions for problems that we aren't defining ourselves as consumers and those with psychosocial disability. And it's for that reason we want to be able to co-design what that looks like. So we can actually say, hey, here are the problems, and then figure out the solutions from our own lived experience. And our lived experience as consumers is a blueprint that we can bring to the table. And the other thing I wanted to say is we need the disability community to, and I come from the disability community, and for those who for those who know, I used to work at the National Peak Body for people with disability. We need them to also understand that there are unique challenges for those with psychosocial and disability and mental health challenges that are disparate but unique to us. That also needs to be aware. Like I think of VMIAC, the very name. It's in the very name. It's called the Victoria Mental Illness Awareness Council because there was a lack of awareness of mental health in the disability movement, and that persists to some degree today as well. And so in other respects, in some respects, there's also a need for the disability community to understand that there is a need for us to self-determine what we need as consumers, alongside alongside the disability communities, in allyship and solidarity with the disability community. So where none of us are worse off. And if we can do that, then we can tackle what's happening within inside and outside the NDIS while trying to figure out all the other things that we need to solve for ourselves.
Thank you, Giancarlo. We have, Leilani, a few questions about the ways that First Nations people can have their voices heard and be involved in the work that we're doing. Before Leilani gives the response in terms of ILEC, I'd just like to acknowledge that we're very strong allies with ILEC, and in addition, there are many Aboriginal and Torres Strait Islander people who are members of the state and territory peaks. But in particular, I'd like to give the opportunity for Leilani to talk about the way that First Nations people can get involved in the movement.
Yeah, and ILEC is the nationally acknowledged and respected organisation. Really kind of making sure that we continue to build a space that we weren't included in for a long time. And in fact, that was the reason why the centre was established, because there was a lot of, organisations that were getting involved in lived experience stuff. And, we just didn't have any leadership in the First Nations space. I think the other thing is to be mindful around, particularly for the Alliance and other organisations that do stuff in the lived and living experience space, is to also jump on and join the mailing lists. So when different opportunities come up, whether it be state-based or nationally for inclusion and consideration, so through an expression of interest or anything like that, they are often where those opportunities come in. So if you join, our mailing list and other organisations like NACHOs or ILEX or any of your local organisations that are represented on this alliance, that's often where you start to hear about those opportunities to come along. A lot of the local peaks also do, come and have a chat. We want to hear about what's happening. So you can slowly start to kind of dip your toe into that space. I know, have given a lot of consideration to, some of the surveys and things that we'll be putting out. How do we actually look at getting people who haven't been included? So what are the different mechanisms for doing that? I think it was a really great statement around the use of, plain language. And that's something that is also really important for First Nations communities, who sometimes English is the sixth language that they learn, depending on where they're living. And when you think about Australia as a country, we sit around the 5th grade national average of reading and writing. For those of you who don't know, it's quite an interesting fact, but that is the truth. So I would just encourage you to, try and find out what's happening locally, get into your local organisation, see if they have any groups where they're including First Nations people around the governance for any programs or services or advice. That would be the best way to do it. Look, it just takes time. I think the more opportunities, the more networking that you do, the more opportunities you'll have where someone will be like, hey, I heard about this thing over there. Do you think you might want to contribute? And I will also just say as a warning, please respectfully don't join anything thinking that you can make a lot of real change. The reality is that there will be a percentage of recommendations from these groups that will be considered and actioned. We can't change everything, which is why we have allies like through the Alliance and other organisations doing leadership, so that the messages are layered and not just coming from First Nations people. We need everyone to actually really kind of, get in there and make sure that we're included in the conversations and the decisions that directly affect us. Thanks.
Thank you, Leilani. We have a question in particular, a question from, I'm not going to read out the entire question because it's quite long, but from Ned Kazevic in relation to mental health support and the LGBTQIA+ community. Priscilla, you would like to answer that question?
Yeah, no worries. And sorry, Neb, I accidentally put your question in the answer pile just because I'm sometimes technologically illiterate. Thanks so much for your question. And as a queer person myself, I really wanted to address it. And you've asked about whether we know much about the risk driven by social discrimination, stigma, and exclusion for trans people versus the hormone replacement therapy. We don't know exactly, and there's other organisations that are much better placed to answer that question. But what I would say is that we are in the process of setting up a affinity group. One of our states and territories has been allocated to set that up. And in fact, probably one thing we didn't go into detail about today is each of our state and territory peaks are setting up an affinity group of some kind. So let me try and remember what they all are. LGBTQIA+, older people, younger people, multicultural, forensic, neurodivergence, and I'm missing a couple. But essentially, we are looking at issues that are affecting each group. And so particularly for the LGBTQIA+ community, which you've asked about, they will be designing their own project. So they may well decide that they want to focus on trans issues, or they may decide some other issue. It's completely up to that group. So that's how we're running things at the moment, so that people who are from intersectional backgrounds are able to have their say and contribute directly to our policy positions. Thanks for your question.
Thank you, Priscilla. We have a question here from in relation to human rights. So, essentially, in summary, it says some states already have a Human Rights Act and some are developing ones. Why do we need a national Human Rights Act? I'm wondering whether, Simon, that might be one you want to respond to.
Yeah, sure. Happy to. So yeah, as the questioner stated 3 jurisdictions. So 3 places have human rights acts. So you've got lovely Queensland, where I am. We established a Human Rights Act in 2019. Victoria did in 2006, and the ACT did in 2004. And really, those pieces of legislation, they try to do one thing 3 different ways. They try to embed a human rights culture across their entire state. And they try to do it 3 different ways, generally speaking, by giving a job to the 3 different parts of government. So for courts, they've got a job to interpret laws in the ways most aligned with human rights. So every kind of law, a planning law, a youth justice law, a mental health law, a disability law, they try to interpret those in the ways most consistent with human rights as is possible. Parliament, the ones who make laws, so sometimes they're called the lower house or the upper house or the legislative council or the House of Reps and then the Senate. They have to pass laws that are meant to be compatible with human rights, but they do sometimes get pretty slippery on that, or sometimes overrule the Human Rights Act or the Charter when they do that. And then the third way they try to do it is that's probably the bit that's, I think, most useful for a lot of our work, is it puts duties on ministers, on government departments, and on public mental health services to properly comply with human rights. And they can't overrule those duties unless other laws require them to overrule it. And so that means the way they set up systems, the way they fund services, the way the workforce gets trained and things like that, they need to be able to show they considered human rights and complied with human rights when they made those decisions. And when people are getting treatment, that those human rights were followed. Now, mental health laws can overrule some parts of that, but not all parts of that. And so the question is why do we need one at a national level? Because different parts of Australia, just like we've got a federated alliance here, we've got a federated constitution or system of government here. And so some stuff is done by the Commonwealth or the national government, things like primary health care, the immigration system. Some people might chime in with some other nationally funded systems. In some ways, the housing system has Commonwealth elements to it. I mean, national security is an area where human rights comes up a lot too. Hate speech and vilification is also done at a national level, like the laws around that. All of that stuff, the state laws don't regulate. So those laws that we spoke about, or the NDIS is a Commonwealth funded system. So we don't have a Human Rights Act that basically says the NDIS has to run according to human rights. So when the NDIA makes decisions, they don't have to demonstrate that they properly considered and complied with the right to equality. They don't have to show that they properly considered and complied with Aboriginal cultural rights. So, for example, if they fail to put conditions around the need for mainstream services to be culturally safe, that could be seen as a breach of Aboriginal cultural rights. So, there's a real gap there that we're not embedding human rights across a lot of nationally funded systems. And then arguably one of the things we could get out of a National Human Rights Act is a bit more of a sharper mindset from government when they're funding the states and territories to attach some human rights strings to some of the money that goes down to state governments. So, for example, it would give them more of an impetus to set national targets around the elimination of seclusion and restraint and compulsory treatment, and then put some strings to the state hospital and health service funding around that kind of thing. So it's what we're going to find in this space is that there's no silver bullets. There's kind of just like, we got to get as many tools to our toolkit as possible. And the Human Rights Act is is a good one. The other thing that Human Rights Act would have helped with a little bit in some cases is robo-debt, which was like a mass trauma producing system for so many people. People have spoken about the fact that parts of the Human Rights Act, depending on how it was applied, could have had a crack at robo-debt when it was happening. So things like that are why it's useful.
Thanks, Simon. Simon's very lucky to have an expert on human rights as part of our
pretty good
board.
himself. Giancarlo themselves is pretty good too. Yeah.
I'm just gonna throw to Giancarlo as well.
No, Simon did fantastic. I just think the one really crucial thing I think that would be really key to know is that even if there was a National Human Rights Act, it would just support strengthen the framework nationally and within states and territories to the extent that you can actually then enforce rights when rights aren't being upheld. So if we say we've got a National Human Rights Act up, you could almost choose. Do you want to enforce your rights through the Human Rights Act? That's at the national level. If it relates to a service or a support that's co-funded and jointly delivered by both levels of the government, or you might want to go down the state and territory path where those states and territories also have a Human Rights Act. So it actually, and that's a really key thing to know. Like if we have a Human Rights Act at the national level and then have one in each state and territory, that really just enmeshes a human rights system into one where we can enforce it even more. So, Simon really spoke a lot about, the things that government can do to ensure human rights are upheld. But of course, as we know, human rights can still be violated. And so it's really crucial that we have enforcement mechanism to keep those in check. And the other thing is, even if you were to have a national right that, there's obviously 3 jurisdictions that already have them. Even if we had a national act come into play later down the track in the future, any inconsistencies would be ironed out anyhow. And so that's a really important point. And then the National Human Rights Act would then supersede any state and territory Human Rights Act. And so that's a really crucial point too, because and that actually even puts more emphasis on the need for a robust National Human Rights Act, because there are some gaps in the existing state and territory legislations. And so how can we actually then use that as an opportunity to strengthen what we already have?
Yes, thank you, Giancarlo. And Leilani.
Yeah, just wanted to add a couple of points just to elaborate, particularly from the First Nations perspective. Simon, obviously you've covered some stuff, but particularly just wanted to talk about the UN DRIPS, the United Nations Declaration on the Rights of Indigenous People. And the fact is, and I think this is why something more national and coordinated is necessary for First Nations people, is that every year when the Special Rapporteur, does the report and review in Australia, we fail abysmally. So how is a nation that have agreed to that specific right on Indigenous First Nations people continually failed and not held accountable or responsible for it? And we see that play out more often than not in way too many spaces for First Nations people who are not treated the same as other people in this country. And I think it's particularly relevant when we look at the stuff that's happening around the laws of sentencing, particularly in Queensland. For young people, it's just incomprehensible to lower the age when we've already got First Nations people, much more represented in incarceration levels around dealing with issues of mental ill health, and disproportionately in what has been, widely shared around the issues of the country failing to close the gap. We have hit some of our targets and we are, shortening that gap, but we've still got a lot of inequalities and issues that are human rights issues. there is a lot of issues around the lack of culturally appropriate and informed services and support, particularly when accessing public hospital and health systems. They just aren't in place, and we've got no rights. And so I just wanted to emphasise the need that First Nations people really need to be included in this, and we need to have some accountability around the fact that this nation has agreed to be involved. We constantly fail in our report on that, and yet no changes happen. So yeah, thanks.
Thank you, Leilani. I've got a feeling I'm being asked to wind up because we're 12 minutes over time. Thank you. I do want to point out we have made a commitment that we are going to address all the questions. And look, I appreciate the people who have posted comments, the people who have posted links, the people who have posted quite specific questions. We're going to try to get to all of those and publish a FAQ that provides responses to each of those questions or comments. So that's a commitment from us. Thank you very much for your engagement. It won't get lost. I note that there's comments in there about inclusion and advocacy for older people. As an older person myself, I highly support the notion of including older people. That about the extent to which trauma-informed practices inform what we do, a lot about the lived experience workforce and how we can support the lived experience workforce. So we'll be responding to those questions and those comments. Thank you to each of our speakers today for being part of this. Thank you to Rachel and Katinka for organising all of the bits that make this whole thing work. Probably the most important people for today's effort. And everyone, please keep an eye on your inbox over the coming days. We're going to be sending you a copy of the strategic plan, answer to the FAQs, links to resources, etc., etc. Thank you for joining us. Thank you for your solidarity, and thanking you very, very much for helping to build a mental health system that's shaped by us and for all. Signing off. Thank you.